All right, everyone. Bill Hanks here and Dr. Thomas, and we're doing our part 2 seminar webinar on the COVID-19 and just what Dr. Thomas can help share with us and provide us with some good insights and tools to be able to navigate through this. So I think this will be a good time to kind of build upon what we went through last week and just kind of keep adding to it and hopefully give you guys some more takeaways and information that you can use in your daily life to help prepare yourself. So you see the slides here. This is the two of us. We'll give you a quick update, the immune process, and Dr. Thomas will talk about that, just kind of like what we need to be looking at doing through this whole process if we were to get some sort of infection and whatnot. And then we'll look at the current situation, what's happening with testing out there right now, and then finally follow it up with some mindset. So I think Dr. Thomas has got some really good things there that will help set the mind right and help put us all at ease and give us the right frame and perspective to navigate through this. As you've probably watched from the news, you've seen that the cases in the United States continually increase. We do have some hot spots. If you haven't heard, New York is pretty hot and heavy right now. Detroit, Chicago, New Orleans, that's an area we're going to have to watch here fairly soon, just because it's similar to Houston in climate. And I think we talked a lot about like hopeful that, you know, heat and humidity would help with the spread of this, but we're seeing quite an outbreak in New Orleans. So that kind of takes away some of that ammo that we had thought about there. Some good news is, if you haven't been watching, Seattle was kind of the first area to break out of, and we had our first case there of community spread in Seattle. And they've really kind of started to bring the curve down. So it's definitely changed there quite a bit. And we're seeing a nice little downturn there and things kind of improving there. So some of the things we're doing, social distancing, all that seem to be working. Obviously, there's areas that need a little bit more help, and hopefully some of these actions that we've been putting in place in these measures will start to affect those curves in those places as well. So just a little bit about what we talked about last time, like focus on the things that you can control and not worry about the things that are out of your control. You have two buckets. You have the bucket that you can control, and these are the things that you can make actions on, and you can do stuff, and you can make yourself be better by working on those. So in the first one, obviously, the avoidance is probably the most important thing that we can do, is just to not get sick. So as we're doing right now, social distancing, avoiding travel, washing hands, doing all those things are going to help prevent the spread of this, but also keep you healthy. Secondary to that, if you were to get an infection, you want to limit the virus replication. So Dr. Thomas has got some really good things there. Talk about nitric oxide, build upon that, vitamin C. We didn't talk much about melatonin, but we're going to bring that one. And hydroxychloroquine, we're going to talk a little bit about that. And then, you know, if you do have a immune response, then you want to have that optimized, and then there's some steps that you can take within that. So I'll turn it over to you, Dr. Thomas, and if you kind of want to just kind of talk about the immune system and why we need it and why it's so important in this COVID-19, this virus.
Thanks, Bill. Hello, everybody. Thanks for being here today. Again, congratulations on everybody doing a really good job of social distancing and staying apart so we can kind of get our act together as this virus we're not at the peak yet, but we have overstepped the rest of the country. New Orleans probably is going to be a real hot spot very, very soon. So we'll witness how bad things can get, I believe. So what all the things that you can do, well, even before that, most of us are not going to get very sick, but the downside is we're very infectious. We can be totally asymptomatic, but we can be infecting others. And that's really the big problem with this virus. And when it gets to a certain threshold of viral load and the way the body can deal with it, that's when the people get into the intensive care units and overwhelm the hospital systems and can create total havoc. So we have recently, through genetic sequencing, have absolutely found out for sure this is not a bioweapon. This really did come from animal to human, that we call those the novel viruses just because they make that leap from the animal world to us, and we have absolutely no defense against that. And that's how, specific to whatever that virus does, can affect us without any defense. We know the respiratory system is the main mode of transmission, but also is fecal oral, maybe as much as 10%, maybe higher. We've found that kids often can be shedding virus for a very, very long time. So again, same thing, wash your hands. And we know how this predominantly works through the virus, which again is nothing more than a protein with some RNA genetic material in it that gets through aerosol or fecal oral, mucous membranes, and then into the blood system where it attaches to ACE2 receptors that primarily are in the lung, heart, and intestine. And that's where the havoc actually begins. And so the immune system is a very complicated system. It's not like a cardiovascular system and GI system and like that. They actually work in concert. It's just that we tend to divide them up in certain ways to kind of tell us how that part of the system is working. When we call it the innate immune system, which I think is this next slide. You know, we got a medical word for everything, but that just really means a body or a cell that's functioning in balance is going to have a lot of defense against all kind of foreign bodies, known and unknown. And that is our innate, non-specific ability to handle even toxins and poisons, for example. And that's our first line of defense. So when we talk about things you can do, which is your lifestyle changes, that's your best bet to not only not get the infection, or if you get exposed, that not develop to a level of infection, but then not to get significantly worse. The second, so there's really three parts of the immune system. It's that innate system, that's just body balancing. More in balance, better your innate system works. And then the adaptive, once you have had exposure, your body's starting to react against it, even if it's never seen, for example, this virus before, it's going to start producing antibodies against the virus, for example. And that happens within the T and B cell lymphocytes. And it takes, some time to do it. It's definitely has a time span part. And then there's the more cellular response, which is the killer T cells, for example, that work both for foreign bodies or that we can identify, and even ones we can't identify. And so when we talk about supplements and things that will work towards this virus, it's working in those three systems. Our body being in balance, trying to make it as optimal as possible. When we do respond, to respond quickly in a very good way so that we produce antibodies, and our antibodies beat the virus, and get our cellular response through primarily killer T cells. Love the name. There's more to it than that, but get those really activated so they're basically killing the cell, killing the viral cell, the cell that has the virus in it, before it replicates more, continues replicating more, and infects other cells. So yeah, just back to what I was about, the virus attaches to these two receptors, gets into a cell, begins replication, replicates to a point that it then has more viral particles that spread to other cells and continues that process to the point that it's infected so many cells that the person is doing really bad. We don't want it to get to that point.
Can you talk a little bit more about like the asymptomatic person and what's kind of going on with their immune system versus someone who actually ends up showing symptoms, and why this thing is spreading so quickly, and just how these two systems work together with that?
Right. So people that are asymptomatic, that means particular to this virus, it may be another virus that would affect them badly, but particular to this virus, that they have their body's in balance in ways that help fight off the virus from the beginning. They're able to quickly develop an antibody response to that. And then their killer T cells, their cellular response works very effectively, very quickly. And so for that reason, they're able to handle the virus, stop it replicating, develop antibodies, and not get very sick.
The only issue is they are spreading it during that time, right?
Yes. So once they've already developed antibodies, they're still shedding virus one way or another through either the fecal oral route or through coughing. So yes, and that's what's wrong, is we know that the most vulnerable are the people that are most likely to end up in the intensive care units, very, very sick with this. But then there's others. There's still an occasional kid that, so far kids have been their defense systems are really particularly good for this virus, but there's still occasionally kids that don't do well, and teenagers. It still hits all age groups. We just know by far, to the extreme, it hits the older age group that are much more vulnerable.
Okay. So the innate immune response, just go ahead and jump in on that there.
So when the body balancing system is working very well, then the virus, once it gets into the cell, has a tough time replicating. So for example, one of my favorite subjects is nitric oxide. And what we know about this virus, and there's several things related to it, that when that's really in balance, that's another thing that will make the virus not replicate as quickly. And that allows more time for the killer T cells to get activated, for example, and then for them to be able to handle it. So maybe we're going to talk about supplements here for a little bit. Vitamin C is particularly good for this virus. We know that for quite a few reasons. We found out very early on in this disease that the people that did badly are the ones that did not mount a lymphocyte response to this virus within about a week plus of getting infected. So when their white blood count, particularly the lymphocyte part of the white blood counts, was very low, those are the people that would do badly. And it just so happens that vitamin C is particularly good for helping us, that part of our cellular immune system, to function very well as the killer T cells. So people are much more likely to be able to mount a lymphocytic response to the virus if they have adequate vitamin C, and if they get it, to actually take higher doses of vitamin C. There's a drug, the hydrochloroquinone, the quinine drug. Do we have that on another slide later, Bill, or not?
We didn't put it by itself, but go ahead and talk about it now.
Okay. Well, it just so happens I was trying to dig in and see why that drug was working, because it seems to work particularly if you combine it with a Z-Pak, an antibiotic. And I'm not real sure why the antibiotic makes it better, but it certainly within studies looks significantly more effective. But it's interesting because malaria, the drugs used for malaria, quenches nitric oxide, and that helps it replicate. the malaria parasite. And the the quinine actually helps build nitric oxide. And so we've already found out early on, before we even knew about this drug, through some studies, that nitric oxide, whenever it was seemed to be working well within the cell, and we have ways to measure that, decreased the replication rate somewhere around 80%. So nitric oxide is out of balance in many, many people, particularly as a person that ages. It's made by the endothelium of the blood vessels, but it tends to start decreasing by age 40. If you're not getting it produced within the body naturally, you got to get it out of your diet. If you're using Listerine or taking medications that reduce acid in your stomach, then you're unlikely to be able to produce dietary nitric oxide. So if you're over 40, particularly quite a bit over 40, and you're not eating leafy green vegetables, and you're using Listerine, and you're taking proton pump inhibitors or antacids, your nitric oxide system for sure is not working well. So that's where we recommend the Neo40 supplement. It's a lozenge. Our salivary glands tend to concentrate the nitric oxide and keeps that circulating throughout our system. So that's why this, it's kind of like a mild sweet tart. You'll suck on it in your mouth and salivary glands concentrate. And it has that connection to the hydrochloroquine that seems to be working, and that all seems to be related to a well-functioning nitric oxide system, which is very important to overall balance within our body, but particularly in the area of the vascular system. There are test strips made by Huemn. You can put spit on that, and it should turn bright pink if that's working well. I was just with a person last night that's 55, not taking anything. She put her spit on that, and it turned bright pink right away. So it's not everybody, but she also wasn't using Listerine or using any thing that reduced acid in her stomach, and she typically eats a lot of greens. Most people aren't doing that, so I'd highly recommend this, and this falls in the category, the vitamin C and the nitric oxide, of things that people ought to do anyway. So we'll have a link for the Neo40. I recommend people, they'll come with strips. Test your spit, save your money if it's turning pink, but if it isn't, then take it. But then get rid of Listerine, see if you can't correct whatever's causing you to need a medication to reduce acid in your stomach. I'm a GI doc, so I know a lot about that, and that can be done. And then see if it starts turning pink without having to use the Neo40 lozenge. Vitamin D is very important to our immune system and overall body function. We get vitamin D from the sun. Vitamin D works better with K2. Vitamin K2 is produced by bacteria in the intestines. Most of our intestinal microbiome is out of balance. And so for most people, if they, there's not many places you can get that done, but if you're tested to see how much microbiome producing, vitamin K producing bacteria, it's possible to check that. Most people don't do too well, so you need to supplement with K2. Most people need to supplement with K2 to prevent calcium depositing into their arteries, but it works very well with helping vitamin D work as well. Also, vitamin A helps vitamin D work very well too. You want to make sure you don't take more than the usual recommended RDA doses, because you can take too much of vitamin A. It's very hard to take too much of vitamin D. Now, the melatonin connection in our little list here. What we found is that it seems like people were doing better with melatonin. So what's the connection? Well, as they looked into it further, the melatonin affects a thing called the inflammasome, which has to do with that cytokine storm. So let's talk about that a little bit. So the virus infects the cell, takes over its machinery, starts replicating, and its purpose of replicating is to develop another virus that can infect another cell and continue replicating. But in the process, it destroys that cell. And when that cell is destroyed, there are inflammatory chemicals that are released, interleukin-1, 6, tumor necrosis factor 1 alpha, are just names for a few. And those it's a double-edged sword with those. You want those because those things actually kill viruses. But when there's too many of those released, the chemical effects of those cytokines starts making changes in the blood vessels. You get dilated blood vessels that tend to leak fluids, and one thing leads to another, and that's where the lungs quit functioning well, particularly because they have the H2 receptor. Cytokines are released, they're released way too much, so it's way out of balance now. You like it in balance because at that point it's working to kill the virus, but when it's out of balance, now the lung cell can't produce surfactant, and you can't breathe. And those people have to be on the ventilator. So the melatonin actually is something that most likely can help prevent a cytokine storm. It's something you ought to have anyway. You may have enough. It's a good supplement. I, for one, am a little sensitive to taking a big dosage, so is Bill. So I'd recommend start low and build up. There is something I've been using off and on for years, which is tart cherry juice concentrate. I actually like the taste of it. You can get it organic from Amazon. It actually helps with melatonin levels, and it helps with inflammation as well. So it's a good post-exercise thing to use to have less soreness following exercise, but also could help in this particular area as well.
Yeah, and I think that we have on here, so this is like, this would be like the dosages you would do pre-symptoms of having anything. So this is just kind of like right now, here we are, we know this is out there. These are kind of the dosages that I should be taking right now, just preventative, kind of as I'm going along. And then we'll talk about here in a sec, just kind of like if you were to have symptoms, what you would step up to. So that's the adaptive response. You just talked about the cytokines and all that. Is there anything else you want to say there? Or?
No, but when a person is, they develop a fever, they develop a cough, they're wondering whether to go to the hospital. I don't know if we've already talked about that yet or not, but if they're having more trouble if they're having shortness of breath and that is getting worse, they absolutely have to go to the hospital. And the things that will happen with the cytokine storm is the lungs will get worse and worse, and they end up on ventilator. It affects all organs in the body whenever you have a cytokine storm, and that's where you get multi-system organ failure, meaning it affects your liver, it affects your kidneys. They start shutting down. There's things you can measure and know that you're headed that direction. It gets to be a domino effect that's very, very, very difficult to treat. And we want to avoid that as much as possible. So you're at home, you have fever, you're thinking you've got the virus. Hopefully we'll soon have testing, but these are the recommended dosage. So do a screenshot of this and save this.
Yeah, I'll send this out in the file to our registrants. Yeah.
Now, what I'll tell you, if you take a high dose of vitamin C by mouth right now, you'll have diarrhea. If you get sick and you start taking a high dose, you'll be able to tolerate that without diarrhea because it's really being utilized. So diarrhea is kind of your endpoint. You're definitely taking too much if you get diarrhea.
This is a melatonin recommendation. I don't think we have to go through it. We already talked about its connection and how it works, but so you would kind of up that dose. Remember back there, we said 0.2 to 0.5, but this here, right here, we don't have to go through it because we'll send it out. But there is, you would increase that dosage if you started having symptoms.
Hey, Bill, how would you do with 50 milligrams of melatonin?
I don't know. If I have too much, it just does the opposite of what it's supposed to do for me anyway.
Yeah, that looks like a very high dosage.
Yeah. Okay, yeah, you kind of talked about this. I wanted to touch on ibuprofen there and just speak about that in general. I mean, not even just in terms of what happens here, but if you don't mind, just kind of touch on that.
They're called non-steroidal anti-inflammatory drugs, NSAIDs. They're really not good for us. They affect our intestines' ability to absorb nutrients. They affect the kidneys. They affect the liver. They're really good for short-term use, not good for long-term use. So people tend to keep them in their purse, in the car, in their desk, in the bathroom, take them for a little bit of this, a little bit of that, and they're taking them on a very regular basis, and that's very unhealthy. So in this particular virus, they found that these drugs really accelerated the replication rate and the ability of the virus to get worse. So definitely, this is not the time. Feel like you got a fever, starting to get sick. I'll feel better if I take Motrin or ibuprofen. That's not the thing to do.
Would you take anything else? Or would you just kind of try to let the fever run its course and monitor, or what do you think would be the best?
People are not running high fever unless they get a secondary infection with pneumonia from bacteria. They have a way to measure that, a procalcitonin level. And at that point, the person should be in the hospital. So the doctors that are getting used to treating these know when that may be happening. So if you just need something to help you feel a little better, you could take Tylenol, but don't exceed the usual dosage. Tylenol is also very bad for us if you take too much. So never exceed the recommended dosage for Tylenol.
Okay. You want to talk a little bit about testing? We've probably had a dozen phone calls on this,
Yeah.
But yeah.
Well, it's interesting because we're doing the right thing, knowing all these details about the virus, knowing to take vitamin C and trying to be healthy, stay in balance. We've known that, but the best way is not get infected. The virus has to have a host. And so we're doing the right thing, but the best way to get us back to work is to test everybody. So this company is an amazing company. This particular video, they were interviewed by Peter Diamandis. I've known him for 10 years. He's amazing. He has a university that you can only be a part of it if you have an ideal that potentially can help at least 1 billion people. So the fact that he was being interviewed by these two CEOs of the company being interviewed by Peter Diamandis immediately caught my attention, because he wouldn't spend time with anybody that didn't have basically a very strong business pedigree. And so in this video, they basically point out that they had the testing and they can scale up very, very quickly with a little bit of help. And they have a vaccine that is essentially ready to go. It's already gone through the animal trials and the beginning of human trials. So they just need a little bit of help with the FDA and they can release the vaccine. The promising part of this is the only way we can get back to work, because again, this virus is very infectious because people get it and don't know they have it. And we're out and about, we're going to continue to spread it. It's going to go on month after month after month, and it's going to be devastating. The only way to get beyond that is to do testing, know who's infected, know who isn't, and allow those that are either not infective and be able to go back to work and usual activities and quarantine those otherwise. So there's a lot of players jumping on to the field right now to be helpful. That was the most important part about us doing our social distancing, is giving time. I understand that the Dyson vacuum cleaner guy has actually now built a whole bunch of ventilators for the intensive care patients, as well as Elon Musk has already built a bunch. And so now we have people jumping on board with our biggest challenges. They're 3D printing masks. A lot of people are. And so we're now, because we're giving ourselves a little bit of time before we hit the peak. We haven't hit the peak in the United States. We're going to be able to do more about it. But the ultimate answer to getting us back to work and back to our usual activities is testing everyone.
Yeah, and I think one thing to touch on is they also have a different kind of testing that they do versus, the typical swab test, PCR test that's being done. They have the antibody test that can tell you, one, if you've never had it, and then two, if you currently have it and you're infectious, and then three, if you've had it and you've built up the antibodies. So those three stages there are pretty important because you could, keep the people who haven't been affected, keep them away from the people who are currently infected. And then the people who have been infected in the past, have those antibodies, they can also get to work. But right now, those people are not being able to do anything as well. They have to stay quarantined and all that. So we just don't have this status and this array of, where everybody is at. And we're learning a lot right now. So hopefully a different kind of testing like that. I saw the White House report, they were talking about it, and I hope that kind of testing comes out fairly soon.
It's very exciting. We may be at the end of the tunnel. And I in area of robotic surgery that I actually do as well. There was a Chinese robotic surgeon talking about in China that basically it's taken them about 2 months to start returning to normal. So that's helpful to know as well. And while it's not completely normal, it's closer to normal. People are starting to be able to do many of their jobs and functions now. We have an NRP. If we can get testing done, I'm hoping that within 2 months, we're going to start seeing a return to reality on some level.
Okay, so do you want to kind of share some closing mindset things? I know you like John DiMartini, and anything there you want to say just as far as we depart here, how to not only leave here with some knowledge on what to do, but how to handle this from a mindset standpoint.
Well, I'd encourage those interested to go to Dr. John DiMartini's Facebook side and then maybe into his website. He's a polymath in many, many different areas, meaning he's an expert in many areas. He kind of tries to cover the 7 major areas of life. So even financially, this is gonna be a tough time. He has really solid information on finances because he's a proponent of having at least 6 months of money for whatever may come along, as well as how to do forced accelerated savings, for example. But basically, he has this little topic here: there's no crisis without a blessing, no challenge without an opportunity, no setback without a step forward, and no experience that can't initiate greater meaning. So out of this, there's going to be good that comes. He has a process called the breakthrough experience. Part of that process is whenever there's something that you may be considering bad, to look at the good side of it. And so if you're feeling a lot of anxiety and concerns about what's happening, to make a very long list, he likes people to make a list of 100 of why what's happening is good. And I encourage people to do that. I encourage people to tap into his wisdom.
Okay. One thing I'd like to just add to that is just, as I was saying, you gotta take this and act on the things that you can control. I think if you sit there and worry about the things that you don't have control over, those can just kind of compound. So looking at what you have control over. We talked about a lot of the things here, and we'll summarize those things in this presentation that talk about the recommendations prior to having any symptoms, and then the recommendations what you do if you did have any symptoms there, and how you could help that along. But we do have some questions here. I've got one: is there any difference between vitamin D3 and vitamin D/K2?
Well, I assume that vitamin D/K2 is the vitamin D3. Pretty much everything's D3 now, but say 5 years and absolutely 10 years ago, they sold different forms of vitamin D that was not effective.
Mm.
They've pretty much all disappeared from the market now.
Right. Yeah. I think, and the K/K2 just means that it has K2 with it. They work together, like you were saying earlier. I had another one. If you had malaria, or if I've had malaria, it was 40 years ago. Does that help with immunity?
Probably not.
Okay.
It probably has no influence.
Because this is novel and it's totally different.
Yes.
Right.
It would be much more dependent on your other systems and how healthy and everything you are now. It'd be interesting though to get the human test strips and see how your nitric oxide system is working.
That would probably be one of the best things you could do. And then add the lozenges if you needed to.
Yeah.
Okay, well, we'll link to that again. I think we did that last time. And we'll put the slide together with those recommendations. And yeah, I think it was another good little talk. We finished 35 minutes, so not too bad. And
that was our goal.
we didn't want to make it too
long. Bill, is so we'd like to continue doing these, some of these on some sort of regular basis, but kind of move away from the virus because we're doing everything. We just need to catch up.
Right.
Not a lot left about this virus that we're going to have to hammer over and over and over again.
Right.
But what Bill and I are all about is optimization. And the optimization is getting our body systems in balance as possible. So yeah, we'll start talking about those kind of things.
Yeah, and bring
exercise in the cardiovascular system, maybe one, for example.
Or peptides or genetics, epigenetics, things like that we could talk about for hours. But yeah, you're right. I mean, we do need to shift a little bit from this virus because, hey, we know what we need to do. We have that under control. So what are we going to do next? Let's take another step and continue to build on this. I think one of the most, one of the most best outcomes that could come out of this is just like people shifting their focus from, being reactive and sick care and moving more into optimization and being health focused and just taking that pre-step before getting sick. So we hope that this whole situation just kind of leads us in a new direction, which, we will have changed mindset from here going forward. I think people will never think the same after this.
And along with that, creates new habits. And I give one other reference. I actually spent time with this DJ Fogg. He has a book called Tiny Habits. And you can go to tinyhabits.com. A lot of free stuff out there on that, but he's an expert on creating habits and positive change.
Okay. Well, I hope everybody enjoyed it. Thank you for joining us. And I hope you have a good rest of the day and weekend. And like I said, we'll look forward to the next one that we have. And if you've got any suggestions on topics you'd like to hear from us, let us know, and we'll kind of build into that.
See you later. Bye-bye.
Thanks, Cliff. Bye.